This is the Emergency Medical Minute, sponsored by Health One.
So this is kind of very pragmatic medical minute. We see plenty of hand fractures. Usually hand fractures involve something to do with being jealous about a girl and then getting drunk and punching a wall. But 25% of our hand fractures are boxer's fractures, which are defined as a kind of a shaft fracture of the fifth metacarpal. Usually those are angulated a little bit, but if they're angulated less than 60 to 70%, we feel like you're not going to need operative repair, and we can just put them usually in an ulnar gutter splint, and then they get converted over to a cast by an orthopedist. But in other parts of the world where they don't have, tons of fantastic orthoglass or other things, they actually treat those fractures different ways, suggesting that we could as well. So this is a study called Is Buddy Taping as Effective as Plaster Immobilization for Adults with Uncomplicated Neck of Fifth Metacarpal Fracture, a randomized control trial. So they basically took people with uncomplicated boxer fractures. They couldn't be open, they couldn't be rotated, they couldn't be intra-articular in the joint, and they randomized them to either getting a ulnar gutter splint, as we usually do, or just buddy taping the fingers, which seems like kind of minimally invasive, maybe not enough for these types of fractures. But they recruited about 126 patients. They lost 26 of them to follow-up. So they had roughly 50 patients who got an ulnar gutter, 50 patients who got just buddy taping alone. And they found that in terms of their functional outcome, a couple of months down the road, in terms of their pain scores, they were equivalent. The people who just got buddy taping returned to work a little bit faster. And then there were one or two people who just got buddy taping that ended up getting surgery, but they didn't think it was related to the buddy taping itself. So it suggests that maybe these patients could just go home with buddy taping alone, just like a broken toe, and they would probably be much happier not having the big, bulky, orthoglass, stinky splint on their hand. So not ready for our routine practice for us, but if you happen to be the guy who punches a wall yourself, you may not need to come into the ER and get an ulnar gutter splint. You can just buddy tape it and get some follow-up. That's it.
We are on a quest to provide the world with free medical education. Please help us out by rating us on iTunes, following us on social media, and subscribing to our newsletter at emergencymedicalminute.com.